is Christina Singh. I started coming to Maximize Living, Dr. Stetson's Maximize Living office, October 2016, and I started coming, honestly, I was having back issues. I've been having back issues almost my entire life, at least since I was probably about 9 years old. And then it got to the point where I was going to another doctor, and they said if I came in again for back issues, then they were going to send me to a specialist. And so I decided to do my own homework to get checked out, and that's how I found Maximize Living. They had a 5-star rating on Google search. So I was like, okay, well, 5 stars, so I'll start going there. And I've been coming here since me starting therapy, x-rays, therapy, the possibility of surgery, because it was actually a nurse practitioner instead of the doctor that I was seeing. And so that nurse practitioner was like, it's been going on for probably a little too long. So it's probably at the point where surgery would be involved, and that's probably my biggest fear, is surgery. My sister has back issues. Some of my coworkers have serious back issues. People have had rods and nails and all these things put into their backs, and I've seen how it affects my relatives, and I just didn't want to do that. So if there was anything else besides that, I wanted to try that first. With back pain now, it is nowhere near like it was. Honestly, I came in for my lower back. That was the biggest kicker. I came in for my lower back and actually found out that I had the most problems in my neck. It was absolutely horrible. I cried my eyes out. I was really depressed after that. I really was. So to find out that I had kyphosis and some of my discs were degenerating, it was very upsetting. But at this point, again, I started in October, and now if I feel any lower back pain, it's more than likely going to be if I sleep wrong. If I feel any neck pain, I mean, if at all. I used to have a little bit of neck pain, but nowhere near as bad as my lower back was. With neck pain, like, I don't even know if I really get it anymore unless, someone just bumps me in the neck or something. I had hip issues, I had knee issues. Sometimes my hips feel a little bit achy. But again, nowhere near as bad as it was beforehand. So it's like I said, for the most part, it's how I sleep now. That'll determine if I have lower back issues or not. But I feel so much better than I ever have before. At least in the past, I can say probably in the past 5 or 6 years. I'm 28, and my first issue was probably when I was about 9 or 10 years old. Considering the options that I've had before, I would probably consider a chiropractor first. Before, the first thing somebody throws at you is medication or surgery, I would probably look into other remedies that a chiropractor might be able to offer. Especially coming here to Maximize Living, it wasn't just, okay, we're going to do this to your back and that to your back, this is what's wrong, so we need to do this. It was I don't know, it's very difficult for me to describe, but it was what I was looking for. I didn't want medication, I didn't want surgery, I wanted to get better. And so it wasn't just, okay, we're going to adjust this and adjust that. It was a lot more than that. But if I ever had to choose between getting surgery and just getting adjustments and regular checkups on my spine, I would choose the adjustments and regular checkups. Another reason for a few nervous breakdowns.
For what?
I had quite a few. Honestly, within the first 2 weeks of finding out all of my issues, I cried so much. I cried a lot. Well, for starters, I was working 2 jobs at the time, and both of my jobs I do a lot of heavy lifting. And one of my jobs, I'm a nutrition education specialist, so I teach everybody how to eat healthy and what to do. And so at least 80% of the time, I'm one of those people. I eat extra healthy, or I try to. I exercise on a regular basis, and then when I came in here again, finding out not just my spine, but I had fecal blockage. When I saw my GI tract, I was like, this is not my body. This is someone else's body. I was like, he's got to be showing me the wrong exam. I was really emotional. I've had hormonal issues since 2009, I was depressed, lots of anxiety, severe depression, horrible anxiety. And honestly, after coming here, again, it wasn't just about getting my spine adjusted and getting it tweaked so it's looking the way it's supposed to. It was my GI tract is now working better than it has in years. We did, I think probably after the third x-ray that I had, majority of this fecal blockage, which took up a lot of my GI tract, was gone. So I was so happy about that. But also too, I realized that with my energy levels, I didn't have to drink as much caffeine as I was, because I am a caffeine addict. My hormones, so because of my hormone issues, I can tell when my hormones shift where I have not enough estrogen or too much testosterone, because my body will literally change. So just like somebody was taking, if a woman was taking hormones, if she wanted to change over to become a man, my body was actually doing it naturally. So my hips would come in, my shoulders would get wider, and my rib cage would open up, and it was actually very painful. So after we started the adjustments, I realized that my body was the way that it should, and in regards to my cycles and everything like that, where they're still not regular, but it is a huge difference for me. So, I mean, I know some people will probably be like, well, I don't know if that has anything to do with it, but quite honestly, looking at the x-rays, I was a tutor for anatomy and physiology, and sure enough, the nerves that go to the GI tract and my ovaries and my uterus and everything, that's where there have been adjustments. And so, like I said, I'm not saying that it is necessarily that, but I have noticed that in this 4-month time frame, those have been the greatest differences. And again, with Maximized Living, it's not just, you know, this and that. It is, you know, a lot of support, emotional support. So whatever your goals are, I have been getting a lot more support than I was expecting. Dr. Stetson doesn't, some doctors, all I hear about is organic this, organic that, you need to do this, you need to do that. But Dr. Stetson and Dr. Canal and Miss Alexis and Miss Mary and Miss Kelsey, everybody has been such a huge support. Again, with the depression and anxiety that I used to have, I have more hope for the future, because I'm not gonna lie, I had some thoughts. I was like, this was my last straw after the year I had in 2016. That was the last straw, but it was all the emotional support, along with those positive changes with my body that made everything so much better. And I'm not sure, after all my experiences with doctors in the past, honestly, I think my first checkup or my first huge issue was when I was 14. So in the past 14 years, this is the first experience where this is what I was looking for, where it's mental, emotional, and it's the type of therapy that I needed, not just drugs and surgery, but okay, what is really wrong with your body? Let's try this first and see what difference we can make. No, I mean, and it's all true. I'm not gonna lie. This, if I would ever say anything, like I tell my relatives, like I know the money is the biggest issue with my family, but this is the place where I would go for anyone. I think it's the best treatment I've ever had, definitely considering the treatments I have had, so.